For those of you who have arthritic hips that are booked to have a hip replacement surgery, there's something that you really need to consider that I think sometimes gets overlooked too much for some of the more other complex things. And this is something really important that we're going to go through in this video. Now, in order for someone to get to the stage of having a hip replacement, that's going to take a long time, right? And you have to consider this, like if you've just started to develop hip pain, if you've just been diagnosed with an arthritic hip, you probably aren't going to immediately after 2 seconds go down the road and start booking yourself in for a hip replacement. Often there is a period of time, but there's a few factors. You either have to have a pretty long waiting time depending on the country you're in, even if it's decided that you're going to have a hip replacement. So you could be waiting months and months, if not over a year, to get to that point. And that's after you've already had hip pain for quite a long while. So think about this picture, right? And this might be you, and if it is you, comment and tell me if this resonates. But I want to hear from you guys. But like, imagine this scenario, right? You've had hip pain because of an arthritic hip for 1 or 2 years, and then you've waited another year or 7, 8, 9, 10 months for a hip replacement. But what's going to happen? In that time frame, you're in pain. You're walking differently, you're walking awkwardly. And as a result of all of these factors, it's impossible for there not to be some level of deconditioning. Because you've got to consider this, right? If you're in pain and the hip pain is so severe that it's starting to govern the social decisions that you're doing and it's impacting your activity or in your social life and your activity levels, well, it's probably at a point where you're unable to do as much. Now, if you're unable to do as much, then obviously with that, hand in hand, comes weakness and deconditioning, and that just happens over that period of time. But the other thing that you have to also just think about is, well, look, what is an arthritic joint? First and foremost, ball and socket joint. There's a bit of kind of like degeneration, there's some change, the mechanics of the hip changes. As a result, some of the cardinal signs that you get are because the hip doesn't move as much. So you've got a joint that doesn't move and give you the range of movement that you once used to. Now, imagine your bicep as an example. Imagine if you couldn't move your elbow, right? And you could only move your elbow half the amount. What do you think is going to happen to your bicep? The bicep's going to decondition. The bicep will decondition because you can't move the elbow. Well, it's no different to the hip, because now your hip cannot move throughout these ranges because it's restricted and because it's stiff. Well, if it's restricted and it's stiff and it can't move, then what's going to happen is those muscles that are usually active in those ranges of movement cannot move, cannot work. And as a result, they get weaker and they decondition. So not only have we got a history of the joint getting stiffer, muscles getting weaker, and a delay or time that you've got to wait until you have a hip replacement also feeding into that potential weakness or deconditioning picture. Well, then where does it leave us afterwards? Because you've spent all this time, hopefully not, but potentially deconditioning and getting weaker. And then you've got the surgical procedure. Now the surgical procedure, look, it's great, fantastic, great outcomes, great surgery, but also it's quite a big procedure. It takes quite a lot out of you. The recovery needs to be really particular. But as a result of that surgical intervention, even if it's minimally invasive, even if it's muscle sparing, even if it's anterior, you are still going to get some degree of muscle inhibition of some sort, because ultimately you're in pain. You've also got hip replacement surgical procedures where it's a little bit more invasive and impacts the lateral hip muscles and the glute muscles a little bit more. So all of these factors post-operatively will also potentially feed into that deconditioning, weakness, and kind of picture of what we need to address afterwards. And that's something that's really quickly and easily overlooked, because we always think that you have surgery, right, now we're going to start to rehab it. But that's not the case, because we've just said now that the whole history is quite in depth and could take a while beforehand to get to that stage. Then you've got the delay to the surgery, and then you've got the outcomes after surgery. And the biggest thing, and this is kind of partly why I did this video, is because sometimes people think that I've had the hip replaced, well, I'll be all right. Like, I'll be able to go and do this, I'll go and do that. Well, you can't, because you're using the hip in a range and positions that it probably hasn't been used for a long period of time. Possibly also why you've got back pain, and sometimes the back can get into grips and start to give you a bit of a problem as well. Back pain is really rife and closely correlated with hip conditions like this. So you've got one possibility there. You've got trying to go out, trying to do too much too soon, thinking I've had the hip replaced, but realistically, one, the behavior of movement that you've had all up until that point is still there. Your brain still thinks it's got a hip that's like that. You're still going to move like you did before. It will take a little bit of time for you to adapt to those changes longer term. But then also you've got to consider the fact that, well, even if I've got function, even if I'm starting to be more mobile, to get to a level of where I want to get to functionally and be that robust, it takes some time. It will take some input as well. It might be that the hip feels great. It might be that you feel like you're doing really well. It might be that you actually feel like, actually, I can do probably more than I'm able to. But all of these things take time. You're not going to be able to rush it. You're not going to be able to do all the things that you think you can just because the hip has been changed. You've got to kind of start bridging the gap of how it was and the impact and the impairments that you had before, and also the impact of having had quite a big surgery and trying to rehabilitate it afterwards. So patients being told, oh, it will settle down and you do this, you do that, and it'll better. It will, but also you have to be really picky, you have to be really specific, and you have to make sure that your rehab is also robust enough to enable you to get to that point. And unfortunately, loads of people don't even get any rehab. Loads of people have the hip replacement, hip resurfacing, and don't get that intervention afterwards. And I think that's absolutely a cardinal sin, because there's so much that you can do. Now, the focus, from a management perspective, almost takes it takes two lights, right? On one hand, you've got the early stages where you're just trying to recover and get over it and get rid of the pain and get those early symptoms in and out of the way. And then the focus is on more functional things, right? Because you want to get off the sticks, you want to walk better, you want to be able to kind of walk up and down stairs normally. So the focus is almost like heavily on the first few weeks about trying to get someone functionally a bit more normal, right? Because the more independent you are, the less dependent you are on sticks and crutches, well, ultimately, the better it is for that individual's recovery. Now, as we start passing that phase, that's when we start to try and address some of those points that I've just said here. And a lot of it comes down to, when we're talking about nitty-gritty physio, it is strengthening exercises, but strengthening exercises that are particularly specific to that individual. And we're talking about muscles all over the hip. It's not just going to be the glutes, it's not just going to be the hamstrings, it's not just going to be the hip flexors. You have to consider the fact that this hip, essentially, for quite a while, has not been moving how it should have been moving. And we have to start to finesse these kind of outcomes and really start to push it. But that's when rehab can be fun. Now, it shouldn't be boring, but also in the same breath, I've said to you that for years and months beforehand, either you listening to this or a patient or someone in this scenario may well have had to reduce their ability or what they've been doing. So if you're reducing your social output, if you're reducing your exercise output, you have to start introducing that into the plan as well. There's no point just saying, right, there's weakness, there's deconditioning, we're just going to do exercises to strengthen and strengthen and strengthen. Think functionally day to day, like what is that person wanting to do? Go out for walks, go to the shop, try and quantify that as part of rehab, because otherwise it's hard to kind of deduce what's right and what's wrong. Also, you don't know, it's hard to measure saying I'm just walked to the shops and back. That's why step count and keeping track with steps I think is quite useful, because it's a tangible measure of something that we can look at and use within rehab, because then you can say I'll increase it by 20% next week or 15%, and you've got time. But also on the kind of flip side of that is, if you're doing too much and if it's too painful, then you can say we'll strip it back by like 2,000 steps a day or something like that. So I think that's really, really handy there. So we've got working on getting people a bit more functional in the early stages after the surgery and getting pain down, and then really putting that focus on trying to recondition the hip, trying to get someone stronger, get them more physically more robust, whilst also at the same time really trying to get them a little bit more active, lifestyle changes and things that they've had to avoid over a period of time. At that stage now, then things are starting to look a lot more positive. And it's probably at that stage where people who are wanting to get back to more like high level activity, high level exercise, can start to refine what they're doing from a rehab perspective and start to increase the difficulty a little bit. But this is a problem. Unfortunately, the biggest issue with people who sometimes have hip replacements is they don't get enough rehab afterwards, or the rehab that they're doing is just not considering all of the history before. So if this is you, like I said, comment, I want to know, I want to kind of hear your experiences, but also remember that example of the bicep. If you haven't used your elbow for a long period of time, that bicep is going to weaken in certain areas, is going to decondition. The hip is no different. If you haven't been able to get out of the car, wash your feet, put your shoes and socks on and cut your toenails for all this period of time because the hip has been so stiff, well, just think about all those muscles that haven't been able to work in those ranges of movement, in those positions for as long as they've had. They're going to be weaker, they're going to be deconditioned, and it will take a while for you to get back up to that point. Don't be too hard on yourself. Don't be despondent. Don't expect it to be amazing after 4 weeks. If you're 3, 4, 5 months down the line and you're struggling, that can also happen. Just take a step back and think, have I got the right support? Have I got the right physio input? Is there something that's maybe slowed your progress down in comparison to someone else, whether it's physically, psychologically? These things happen. Don't worry. You just need to make sure that you try and optimize every level as much as you can. There's always scope to improve. You just need to realistically make sure that you're in the right hands. If you found this video useful, I say this in all the videos I'm doing. I'm like, look, I want to build a community. I want people who have hip pain to reflect and like communicate here. There's loads of this. Don't get me wrong. There's loads of stuff on YouTube. The problem is there's a lot of stuff that, as a hip expert, I kind of worry that loads of people are seeing it, and I think there's better information. I'm not saying I know everything, far from it, but I'm hoping all I share here is good evidence-based advice, expert opinion, pragmatic, and just normal advice. You know, none of this fancy stuff. Everything I film is pretty much in one go, so there's not going to be any faffing around here. Just decent, honest advice. And I hope you enjoyed the video. Let me know, and see you at the next one.